All right, so like I said, we're going to start here with neurocognitive disorders. There are lots and lots of different types of neurocognitive disorders. This might be one of the sections that has the most subtypes within it. So we're going to kind of talk about each of the big ones at least in turn. So we'll talk about delirium and Alzheimer's and Parkinson's disease. We'll also talk about things like traumatic brain injuries and stroke. There are a few others within this category, but they're a little less rare, or a little more rare, sorry. And so I didn't include all of them. We'll talk about the major ones. And for a lot of these, unfortunately, there are not a lot of effective treatment options. Some of these diseases are neuroprogressive, which means basically the symptoms start at a particular time point, usually kind of towards elderly ages, and then progressively get worse and worse and worse. We do have some medications that can help treat very specific symptoms or that can maybe slow down that progression, but in general, we definitely don't have any cures for most of these, and treatments are not always super effective. So some of the common symptoms that you'll see in each of these disorders relate to all of these different cognitive dysfunctions. So people with a neurocognitive disorder often will have issues with complex attention. So complex attention is basically the ability to sustain or divide or have selective attention. It also relates to processing speed. So, when you're listening to the podcast and you hear a person's kind of attention jumping from one thing to another, they can't keep their attention on one particular topic. That would be an example of that. Executive function, we've already talked about quite a bit in the context of attention deficit hyperactivity disorder. So that's the ability to self-regulate in general, to plan, to organize, to self-monitor, impulse control, all those things we talked about with ADHD. They also often will have issues with learning and memory. So it may be difficult for someone with a neurocognitive disorder to learn new material. And they may also struggle with remembering things from their past. And the type of memory that's affected can vary depending on the type of neurocognitive disorder we're talking about. In general, they often will start to lose some of their episodic memories, so they won't remember specific events from their lifetime. They will also maybe start to lose memory of things like people's names, even people in their own family that they're very close to, etc. They also may present with issues with language. So they may start to struggle to just produce language. They may start to lose an understanding of what words mean. Some of them we will see have perceptual motor issues, particularly with Parkinson's and Huntington's disease. So they may have issues either initiating movement, be very rigid and have difficulty moving, or they may have tremors and spasms. They basically just lose control of their motor abilities. And then they also may struggle with things like social cognition, so understanding other people's emotions, understanding the perspectives of other people. All of those could potentially be dysfunctional in someone with one of these neurocognitive disorders. So neurocognitive disorders are broken down into three main categories. The first is delirium, the second is major neurocognitive disorder, and the third is mild neurocognitive disorder. We're going to talk about each of these. We'll focus most of our time on major neurocognitive disorder. We'll talk very briefly about delirium. And in general, mild neurocognitive disorder is going to be very similar to major neurocognitive disorder. The main difference, in the name is just that the symptoms are going to be a lot less severe. Often you might have someone who starts out with mild neurocognitive disorder, and then as they get progressively worse, they kind of eventually make their way to a diagnosis of major neurocognitive disorder. So just in general, delirium, people with delirium tend to have disturbances in attention. They have decreased awareness of their environment, so they kind of seem to not necessarily know what's going on, really. And they have a lot of disturbance in cognitive performance. So some of those cognitive areas, things like learning and memory and language, they're going to struggle with. Delirium often will occur as episodes. So someone might have an episode of delirium where they, kind of suddenly have all these cognitive issues, and then the delirium will fade, maybe over the course of a few hours or a day or maybe up to a week. Those episodes can last. Depending on the cause of delirium, those episodes can get progressively more frequent, and then there's less and less breaks in between them. And in the worst case, delirium can progress all the way to very severe symptoms, things like seizure, coma, and even death if it's left untreated. Major neurocognitive disorder, like I said, we'll spend most of our time talking about that, but just to start you off, that includes a lot of different subtypes. It has things like Alzheimer's included in it. We'll talk quite a bit about that. Things like traumatic brain injury, vascular issues, things like strokes, Parkinson's and Huntington's disease. Those would all be included in major neurocognitive disorder. So we're going to spend pretty much the rest of the time here talking about those different categories of the major neurocognitive disorders. So first, let's talk about Alzheimer's disease. So Alzheimer's is, this progressive disorder where someone, like I said, often will start at kind of the mild end of the spectrum, and then things get progressively worse as they get older. We'll talk about epidemiology in just a minute, but usually this is going to affect someone like over the age of 65, although you can have what's called early onset Alzheimer's as well. And the main cause, like the mechanism of what we think at least causes Alzheimer's, is all about these issues that are going on in the brain that affect the neurons. So one of the issues is what's called beta amyloid plaques. And beta amyloid plaques are basically this sort of protein substance that builds up in the space in between the neurons. So it's kind of in the synapses, all in between the neurons. And it basically makes it so that the neurons cannot communicate with each other as effectively as they could before. Neurofibrillary tangles are within the neuron. So within the structure of the neuron, there are proteins that get kind of tangled up. And again, that really interferes with the communication of neurons from one neuron to another. Both of those issues, beta amyloid plaques and neurofibrillary tangles, can cause inflammation in the brain. They can cause the neurons to die or to shrink or to, withdraw their synapses. So overall, they're basically just making it, like I said, so the neurons cannot properly communicate with each other. In addition to things that are happening at the cellular level, there's also kind of systems level issues going on in people with Alzheimer's as well. So they often have shrinkage in specific areas of the brain that affect, some of those cognitive issues as well as some other issues. So they often will have shrinking in the hypothalamus. We've talked about the hypothalamus a little bit. It's the structure that communicates with like the endocrine system, sends information to like the pituitary gland. You also have shrinking in the thalamus. The thalamus is a really important structure in the brain that basically helps us sort out sensory information. So as all this sensory information, you're getting visual information, auditory information, touch from your skin, etc. The thalamus kind of sorts all that out to where it needs to go. So you have shrinking of that area as well. There's also shrinking in an area called the locus ceruleus. And that's really important for like your overall arousal level, your attention level. It's involved a lot in the sleep-wake cycle. So it regulates when you fall asleep and get tired, when you wake up, how alert you are throughout the day. And then also the basal forebrain, also kind of involved in that sleep-wake cycle, things like body temperature. And then in addition to all of those, you might see also shrinking in the prefrontal cortex, which is involved in some of those like executive functions that we talked about earlier, things like self-monitoring.
What was the other one you said? That it was the thalamus?
We've got hypothalamus, thalamus, locus ceruleus. That one's spelled kind of weird. I'm not even ever 100% sure that I'm saying that word right. C-E-R-U-L-E-U-S. Locus ceruleus. And then basal forebrain. And then the prefrontal cortex are the ones I talked about. All right, so as far as the causes of what causes all of this to happen in the brain, We do know there's a fairly strong genetic component to Alzheimer's disease, particularly early onset. So early onset Alzheimer's is basically anyone who starts to show symptoms before the age of 65. And typically that early onset is very strongly driven by genetics. So if someone in a family has that early onset Alzheimer's, it's pretty likely that their children and other family members might have it as well. The later onset, so people who develop symptoms after 65, that tends to be more caused by environmental factors. So exposure to environmental toxins, in particular, they've shown that like really high levels of zinc and also lead exposure can contribute to like buildup of that beta amyloid. So something about the interaction of those heavy metals with the beta amyloid basically causes it to build up more quickly. And then there's some evidence as well that having poor sleep hygiene throughout your lifetime can also increase the risk of Alzheimer's. And one of the theories about why that happens is that when you're sleeping, when you're getting good sleep at least, especially like deeper stages of sleep, one of the things your body is doing is flushing waste from the brain. So there's stuff called cerebrospinal fluid that circulates through your brain, through your spine, and that helps, it gives your brain all the nutrients it needs, sugar, oxygen, etc. But then it also flushes away all the waste materials that build up in the brain throughout the day. And that includes things like the beta amyloid plaques. So if you're not getting proper sleep, then your brain isn't getting an opportunity to drain and flush away all those waste materials, and they build up and can contribute to all those issues we just talked about. But there's kind of a chicken and egg here. So I talked about one of the structures that's shrinking with Alzheimer's is the locus coeruleus, which contributes to that sleep-wake cycle. So we're not really sure, is it that the sleep disturbances come first, like maybe someone has really poor sleep habits, they're on their screen late at night, they're drinking caffeine too late or whatever, all those things cause sleep disturbances, and then those sleep disturbances cause issues, or it could be that someone has maybe a genetic predisposition that's causing that locus coeruleus to shrink and have issues, and then those issues cause sleep disturbances, right? If the part of your brain that's regulating sleep is messed up, then you're not going to be getting proper sleep. So it's kind of a chicken and egg, which comes first, which one is the cause, which one is the effect. We're not really sure. Okay. As far as treatment for Alzheimer's, really the best treatment is prevention. So things like sleep hygiene are incredibly important. Even given everything that I just said, the fact that we don't know necessarily which one is cause and effect, there's still really good evidence that if you're practicing proper sleep hygiene, trying to get the best sleep that you can, that is going to decrease your chances of developing Alzheimer's. So in general, you guys probably already know a lot of this, but the best things to do to get a good night's sleep is, one, don't be on screens late at night, especially like anything that has blue light. You want to avoid blue light, and have like red light filters are really good. You should not exercise. I think it's prescribed like an hour before bed, because that gets kind of your sympathetic nervous system going, gets you in a state of alert and arousal, so you can't sleep as well. Just having like a set bedtime that you go to sleep every single night, waking up at the same time every single morning, avoiding caffeine anytime really past noon, because caffeine has, I think it's like a 7-hour half-life or something. So if you drink caffeine at, let's say, 2 o'clock, then by 9 o'clock, half of the caffeine is still in your system. So avoiding caffeine later in the day is important. What else? I'm sure there's all kinds of other things. Using things like white noise machine if you need to. Those are all really important for maintaining sleep hygiene. Then in addition to that, there's some evidence that engaging in just like a cognitively active lifestyle can help prevent Alzheimer's as well. So doing things that basically just keep your mind active. Kind of the best advice I can give is just like constantly trying new things, new hobbies, learning a new language, learning a new skill. Those would all be things that would help prevent Alzheimer's disease. I should also probably have it on here that things like exercise and diet also are very important. Your brain is a part of your body, just like your heart or your liver or your lungs or anything else. So if you're taking care of your body, eating well, exercising, then your brain is going to be a lot healthier compared to if you're not doing those things. So if someone does develop Alzheimer's, either they don't practice these prevention methods or they just don't work because they have that strong genetic component or other environmental factors. There are some medications that can help with specific symptoms. So there are medications that target acetylcholine and glutamate, which are neurotransmitters that are involved in that kind of alertness and help, basically just help the brain activity overall. And like I said, those can target some of the specific symptoms. They are by no means going to cure Alzheimer's, and they're not going to stop the progression, but they can slow down the decline in cognitive skills. Okay, and we'll talk about Alzheimer's more when we do our discussion in the podcast. Any questions so far about Alzheimer's before we move on to the next? Okay, next set of disorders. These are like separate in the DSM, but I put them together mostly just because they're kind of short. So TBI is traumatic brain injury. Traumatic brain injury is usually going to be caused by some sort of trauma to the brain. Typically that's going to be maybe like a car accident. It could be things like in sports, you know, if you're having high contact, then those can contribute to TBIs as well. And then vascular disorders are essentially where something goes wrong with the blood vessels in the brain that causes some kind of stroke. So let's start with traumatic brain injury. So the most common type of traumatic brain injury is a concussion, and you sustain a concussion, like I said, usually when there's some sort of contact with the head. And that can happen, so concussion can happen even if you're wearing like a helmet, for example, if the contact is hard enough. This is kind of, I always hate picturing this, but I got to describe basically what's happening. So whenever someone has high impact to the head, you can imagine the brain is kind of floating in fluid inside your skull. I kind of think of it almost like a jello mold or something, but with something in there. And your skull on the inside is kind of this like rough surface. So if you hit your head really hard, your brain kind of like jiggles back and forth inside your skull and will basically scrape against the top of your skull and then impact the front or the back of the skull. So that's obviously not good for the brain, right? To be having that kind of damage. Yeah.
Yeah, my cousin was a football player, and he had so many brain injuries and concussions that he lost his whole childhood. He can't remember it. Not even me, his cousin. So.
Yeah. That's unfortunately very common in high contact sports, like, you know, football, hockey is probably another good example. And that can lead to the second one, the chronic traumatic encephalopathy. So CTE is basically that, where someone has multiple concussions or multiple head injuries over the course of a long period of time, and that can make the symptoms significantly worse. So we all have probably also read about like famous football players that have suffered from this. So the initial concussion, if you have just one concussion, I mean, that's usually not like horrible. It's not super bad. It can lead to things like you can have temporary loss of consciousness, usually very, very short. There might be a little bit of amnesia following the concussion. Typically someone, if they just have one concussion, they usually are going to forget like the moments leading up to the concussion, but they won't forget much else beyond that. You might also have things like disorientation and confusion, dizziness, nausea. There can be issues with the eyes, like your pupils might not dilate or constrict properly. There can, I think, also be like blurred vision and other things like that. So that's just, you know, with one concussion. If you have a concussion, for whatever reason, it's more likely that you will have more concussions in the future. So having one basically makes you more susceptible to having repeated concussions. And then, like I said, if you have CTE, that can lead to this progressive neurological disorder that in some cases looks kind of similar, almost like Alzheimer's or dementia in some ways. So often people with CTE, they'll have declines in cognition. They also typically will show kind of impulsivity, so they have a hard time inhibiting their actions. They may lash out and act out, and they also have a lot more issues with like emotional regulation. I don't follow sports like at all, but I remember there's like some football player that had CTE that was accused of like domestic violence, and there was some, you know, speculation that the domestic violence was because of the CTE, that basically he had completely just lost control of himself because of these repeated concussions that he had suffered. So yeah, it's a really big deal in, you know, high contact sports, things like that.
How many concussions did he have before he got to that point?
That's a great question. I don't know I don't know what the number is that I don't know how many you have to be diagnosed with CTE. I don't know if there is a set number because it also just depends on the severity of the concussion as well. So yeah.
Now, is that proven that domestic violence was caused from the brain?
No, there's no way for them to know for sure. Like if he didn't have CTE, would he have been abusive, you know? But there was some speculation that might be contributing.
There is some suggestion that with severe traumatic brain injury, it can cause behavioral
Yes.
changes.
Yeah. You'll see I do not have a treatment slide for concussion or CTE because there really isn't any treatment. Again, it's more preventative. Trying to prevent having a head injury is the best way to treat it because there's really nothing you can do once they have a concussion or CTE. We don't really have any medications or anything that will help. Okay, so for vascular disorders, like I said, are caused when something goes wrong essentially with the blood vessels in the brain. So hemorrhagic stroke is basically where the blood vessel bursts in the brain. So then you have the brain gets flooded with blood. That can put pressure on neurons, but it's also flooding it with, all kinds of, sugar and glucose, maybe giving it too much. So that can cause damage to the neurons. And then ischemic stroke is where there's a blood clot that blocks blood flow to a particular area of the brain. So then that part of the brain is basically just cut off from the blood supply, so it's not getting oxygen, it's not getting glucose, it's not getting the things that it needs to survive, basically. And with stroke, the symptoms and the severity can be, there's wide ranging depending on where the stroke happens. So, maybe not surprisingly, wherever the stroke happens, whatever function that part of the brain does is going to be impacted, right? If you have a stroke in the left hemisphere in the language areas, then you're going to have issues with language. If you have a stroke in the part of the brain that controls like motor movement, then you might have paralysis. So it really just depends on where the stroke happens and how long it lasts and how severe it is going to lead to the different symptoms. But in general, people who have had a stroke, they might have, some of the cognitive issues that we've talked about with all of the other disorders. Typically with a stroke, a person can recover and make progress even without treatment, but they're going to do best if they get treatment, especially very quickly. So really the only treatment that we have for stroke is called a TPA, or tissue plasminogen activator. And this is really effective for ischemic stroke specifically because it basically breaks down that blood clot that's blocking blood flow to the brain. The difficult thing with TPAs is they have to be administered within 3 hours of the initial symptoms of the stroke, or else they're going to do nothing. They're not going to be effective at all unless they're administered very quickly. So that's why you might have heard if you're ever suffering like symptoms of a stroke, it's very important that you get to a hospital as quickly as possible so that you can be administered the TPA. I feel like there's an acronym for the symptoms of stroke, and I can't remember. I don't know if any of you in like nursing or something remember it. So there's some acronym, I don't remember it. But basically, if you have like paralysis, especially on one side of the body, if you have numbness or tingling, in your hands, or if you feel like your face is kind of drooping or paralyzed, that's often a pretty good indicator of a possible stroke. Language issues, if you suddenly feel like, you're not able to produce the words that you're trying to, or maybe whatever you're saying is coming out as nonsense, that can also be a sign of stroke. There's probably others. Any of you know any others off the top of your head? I should have looked for it before class, but yeah.
You go to drink something.
Yeah, and it's dribbling out the side of your mouth. Yeah, that would be an indication that maybe your lip is like partially paralyzed. So if you ever have any of those symptoms, very good idea to get to a doctor or a hospital as quickly as possible so that you can potentially get that TPA. And that will basically like stop the stroke so that the symptoms are minor and it doesn't progress to something more serious. Okay. I should also mention the order that I'm going through these is based partially on like rates, basically. So Alzheimer's is one of the most common types of neurocognitive disorders, TBI and stroke. I will say TBI and stroke don't always necessarily lead to a diagnosis of major neurocognitive disorder. It just depends, like I said, on the severity and the symptoms. So the rate of people who get a traumatic brain injury and then are diagnosed with a neurocognitive disorder is slightly lower than Alzheimer's, and then we're getting into Parkinson's and Huntington's, which are much more rare than the ones we've discussed so far. So Parkinson's disease, you may be somewhat familiar from like Michael J. Fox, celebrities that have suffered from the disease have made it a little bit more well known, even though it is fairly rare. Some of the symptoms of Parkinson's disease are things like tremors in the limbs and face. That will typically be the first symptom that presents. So someone with Parkinson's, the first thing they notice usually is going to be a tremor in the hand. And then that progressively gets worse to where that tremor kind of spreads. They can also have rigidity in their limbs and trunk. So it may be very difficult for them to initiate movements. If they go to try to walk or do something, it's kind of like their muscles are fighting against them almost. They may have a drooping posture and impaired balance, so that can contribute to lots of difficulties walking. They're more likely to fall over. But then they also experience some cognitive decline as well, again, kind of in all those areas that we've already talked about. Let's see. Parkinson's is caused by abnormalities in an area of the brain called the substantia nigra, which is part of the structure called the basal ganglia, which is really important for movement, probably not surprisingly. That part of the brain is also really important for learning and memory. So it's part of the reward structure that we'll talk about more when we talk about addiction. So someone with Parkinson's disease, they basically have less dopamine activity in that area of the brain. Again, that's called the substantia nigra. So treatment for Parkinson's, again, kind of like Alzheimer's, we do not have a cure for Parkinson's, but there are certain medications that can target specific symptoms and help slow down the progressive decline that we see in both the motor and the cognitive domains. One of the most common medications that's prescribed for someone with Parkinson's is called L-Dopa, which is a dopamine promoter. Basically increases overall dopamine activity in the brain, particularly in that area, the substantia nigra, like I talked about. The biggest issue, though, with L-Dopa is that it has some pretty drastic side effects. It can actually cause hallucinations and psychotic symptoms. So, making the decision to prescribe L-Dopa, you really got to weigh the positives and the negatives. Yes.
Why? It's supposed to help.
Why would it cause hallucinations and psychotic symptoms? I mean, I don't.
Is it a stimulant?
It's almost certainly a stimulant. If you're increasing dopamine, that's pretty much always going to be some sort of stimulant. But it's, I mean, I would assume that it has something to do with the activity that's causing on dopamine.
Yeah, with schizophrenics, don't they have overactive dopamine in the brain?
Yes, it's a little more complicated than that, but there's a specific receptor and specific type of, dopamine receptor that's overactive. So that's probably somehow acting on that same, pathway, but I don't know in detail, what that mechanism is. Yeah.
I know a lot of people that suffer from psychosis and stuff, stimulants.
Right, yeah. Yes, yeah. It's definitely something related to all of that, but I don't know exactly the specific mechanism that leads to those symptoms. Antidepressants as well. So we've talked about things like SSRIs, selective serotonin reuptake inhibitors, SNRIs, selective norepinephrine reuptake inhibitors. Those can also help. So all of those medications have indirect effects on dopamine. So selective serotonin reuptake inhibitors obviously targeting serotonin, but then there's kind of this domino effect where it also increases dopamine by the end of that domino chain. So antidepressants can help with some of the symptoms. Anti-tremor medications, that's going to help specifically with the motor issues, not so much with the cognitive issues. And then there are also some sort of cognition-enhancing medications that can help with the cognitive side of things. So L-Dopa is the most effective in treating all the symptoms, but it has all those side effects like we talked about. So then these other medications are going to be less effective in treating the symptoms, but they tend to have less severe side effects, although they do have side effects of their own as well. The other thing I'll say here, just because when we talk about epidemiology, you'll see, you know, numbers, but with Parkinson's, for whatever reason, I think is the only one that's more common in men. I think all the others are either equal or more common in women, but Parkinson's disease is more common in men. Huntington's disease is similar to Parkinson's in the sense that it's targeting motor abilities kind of more so than the cognitive abilities, but it's targeting both as well. So Huntington's disease typically begins with neurocognitive decline. Again, all those domains we talked about, language, learning, memory, attention, you have declines there. Someone with Huntington's will often make involuntary and repetitive movements. So with Parkinson's, there's like rigidity and tremors, but with Huntington's, it's more like these repetitive, involuntary movements that they're making. They often develop difficulty speaking, which comes partially from the cognitive aspect of language, but also from just like the motor ability to produce speech by moving their jaw and their tongue correctly. And they also often tend to have changes in their mood and their emotions. As far as I know, there really isn't any effective treatment for Huntington's. It's a pretty serious and severe prognosis if they're diagnosed with this.
Isn't it completely genetic as well? Like if your mom had Huntington's, then it's a like 50-50 chance you're gonna.
Yes, yeah, I know there's a very strong component. I don't know if it's exactly like 50, but yes, yeah, there's a very strong component to Huntington's disease. I believe Parkinson's disease also has a pretty strong genetic component, but Huntington's disease as well, yeah. People with Huntington's are gonna have kind of the most quick progression to lack independence, so they're gonna very quickly get to a point where they basically have to have full-time care. Maybe because of that, very sad, but suicide is one of the top causes of death in people with Huntington's disease. That might be due to some of the emotional instability and changes in mood, but also maybe just that feeling of like not wanting to be a burden to other people. So yeah. All right, so as far as epidemiology, I don't have all of them listed here because again, some of them are very rare. So with delirium specifically, it affects about 1 to 2% of the general population. If you just measure, like you ask everybody, have you ever suffered from an episode of delirium? But it's much more common. Yeah, go ahead.
I may have missed it, but what's the treatment for Huntington's?
There is no treatment, as far as we know. Yep. Yeah.
What about managing symptoms? Is it just circumstantial?
Yeah, probably. There'd probably be like more like just training and education rather than like, but as far as I know, there's no medication that really helps with the symptoms. Yeah.
Did you say that it comes on kind of fast?
It's the one, like, it's compared to all the rest, like compared to Alzheimer's and Parkinson's, people with Huntington's more quickly get to a state where like they need constant care. So they lose that independence very quickly. Yeah. All right, so like I said, delirium, pretty rare in the general population, but in specific populations it can be quite common. So it becomes more common as you get into, you know, elderly ages. And it's also common for people who are suffering from any kind of like terminal illness and they're towards the end of the lifespan. So 22% of people in nursing homes will have delirium, and 88% of those at the end of life. So very common for those who are in like a terminal situation. Alzheimer's, you get about 11%, I think, yeah. So anyone between 65 and 85, there's about 11% of that population will have a diagnosis of Alzheimer's. And then as you get above 85, there's about a 32% chance. Some of this, so if you remember, I talked about like the environmental causes of Alzheimer's, and one of the big ones is lead exposure, which at this point we've obviously, phased out lead in lots of products. And so we might see this number go down as the generations that have never been exposed to lead get up into their later years. There might be less Alzheimer's. But it also seems to be it's kind of similar to cancer in a way. I've always heard that cancer is one of those things, like if you live long enough, you're almost certainly going to get cancer, just due to the, it's basically from mutations in your cells. And if your cells divide enough times, eventually one of them is going to mutate in a way that causes cancer. So the older you get, the higher your chances of cancer. And it's pretty much the same with Alzheimer's. Like, the older you get, the more likely it is that you're eventually going to have buildup of waste materials in the brain. So if we keep extending our lifespan, which we seem to be doing for the most part, then the amount of people who get Alzheimer's will probably go up, but it's going to be in later years. Does that make sense? Parkinson's, very rare, so only about 1% of even people over 60 have Parkinson's disease. Huntington's I didn't even put on here because it's even lower. I didn't include numbers for TBI and vascular disorders because, again, like, I could give you a number of how many people have suffered a TBI or a vascular disorder, but it's not necessarily the case that all of those people would be diagnosed with a neurocognitive disorder. So I was having a hard time finding statistics on like that specifically. Okay. Any questions about neurocognitive disorder? Yeah.
I have a question. So there's medication-induced Parkinson's.
Mm-hmm.
So if someone has that, how likely is it that, like, later on in life they would maybe develop Parkinson's?
I'm not sure. Yeah, I honestly have no idea off the top of my head. Do you know which medications it is that induce it? Like, I've heard of that, but it's been.
He was 8, they gave him all, and that induced, like, he had medication-induced Parkinson's.
Right.
It can go when you get better, so I don't know if it will
Right.
redevelop.
Yeah, but you're asking, like, if they've had that in the past, how likely is it that they might develop, like, non-medication induced Parkinson's in the
Yeah.
future? Yeah, I have no idea off the top of my head. That's a great question. But yeah, I'd have to find, there's gotta be a study that's looked into it, but I've never read it.